Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio today with Maynard Nexon healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
And we are joined by two upstate healthcare leaders. William Kenley is the CEO of AnMed, an integrated healthcare system of 4 hospitals and more than 60 outpatient sites of care. And Juana Slade is the Chief Diversity Officer and Director of Language Services. AnMed is one of South Carolina's largest independent not-for-profit health systems. William and Juana, thank you so much for joining us today.
Thank you. It's great to be with you.
Let's begin by talking about men in black coats. This is a national effort to increase the number of black men in the healthcare industry. And William, earlier this year, AnMed hosted the first Black Men in White Coats event in South Carolina. Would you share a little bit about it?
Sure. Well, first, I would say that this really came about because Juana is a wonderful leader for our organization that is always looking for opportunities that we can partner with other groups that have similar missions and purposes, and we can really leverage our work together. It was a very successful event. We were delighted to host it here at AnMed. It was an interesting weekend. It was the weekend of Easter, and it was a Saturday of extreme rain, which we've had a lot of. So that hurt us a little bit. But the folks that showed up, it was just a tremendous event, and I could not be more proud of our physicians and providers that we had there to really just open the eyes of young folks, specifically minority young folks, to be able to see what they could achieve and do in healthcare. We had several members of our team, physicians that spoke about their journey. They're minority physicians. About how they moved through their journey to be practicing physicians today, looking back at some of them where they were at the time that some of these students were. So it was very much a great positive. Juana, you may want to share a few more details about it. You were really the leader of that. I just get to talk about it and smile.
I'm a Juana fan, so I'm with you, William. I'm sure she had something big to do with it.
Thank you both. I think the only thing that I'd like to add to William's comment is the absolute complete candor with which those physicians talked about their journeys. We had some who spoke with the young people who talked about having gone the route of military school. There is one, or military service rather. There was one young lady who talked about kind of making the decision late in her professional development to actually realize that medical school was even a possibility. She didn't know that she even had the academics, and now she's in a very specialized discipline and working here in our organization, and quite frankly, doing very well with our organization. But the most important thing, when we had this opportunity in 2022, we, like every other health system, certainly in the state, if not the entire country, we were struggling with the workforce. And we wanted anybody to come and work with us and help us to fill the vacancies that we had. But we also recognized that in some instances, the data show that individuals are more likely to comply with the medical and clinical guidance and advice from individuals that they can resonate with. Is it impossible to bridge the gender or racial divide? Absolutely not. But we want to make sure that anybody who can come to work in our organization and contribute to attainment of our mission has the opportunity and feels welcome to come be a part of us. And anybody who needs care, both immediate care or long-term relationships with a provider, we want to make sure that they have an opportunity to consider AnMed because of the quality of services we provide and because of the individuals who will be there taking care of them.
Juana, you have a history of impactful firsts in your very successful career, including being the first DE&I officer at AnMed. Can you talk a little bit about how diversity and the work that you focus on is linked to AnMed's mission and its purpose, and how it improves the health and wellness of not only your patient base, but the community?
Sure. I probably could take the remainder of our time simply repeating what William has shared with us when he arrived. I remember knowing that our quote new CEO was in new employee orientation. And so I've been taking copious notes, listening to him and hearing what he had to say. And one thing he said, he's actually turned that into an opportunity to refresh our culture, and that is exceptionalism, looking for every opportunity to exceed the expectations of every patient, no matter who that patient is, no matter where they come from, whether they touch us through or we touch them through our emergency services, or whether they have long-term relationships with them. We have to be ready as an organization to provide appropriate patient care, every patient, every time. And that may mean some different things for people based on the language they speak, based on the culture that they represent, based on their age, based on their socioeconomic status. And all of those are dimensions of differences. If we wanted to, they could all be barriers to providing care. But our responsibility is to make sure that our cultural and our linguistic differences are not barriers to our providing appropriate services.
Right. It's important.
William, on this video podcast, we often talk about health disparities when we're referencing consumers, people like me, patients. But with Men in Black Coats, you're focused more on providers. And why would equity be as important here as well?
Well, I really appreciate the question very much. So why do we need more Black physicians? Why do we need more minority nurses? Why? Well, the first answer, and probably the biggest answer, is kind of what Juana alluded to earlier. We need everybody. We need everybody. There's great needs in our healthcare system, and I believe there's a spot for everyone. That being said, today, specifically, Black men have fallen in the percentage of young Black men going to medical school. The rates today actually are less than they were prior to 1980 that are applying to medical school. Today, we only have about 6% of the physicians in South Carolina are African American. The population in our state is almost 30%, so about 1/5 of that. Again, we need everyone. I think people don't necessarily, they choose their physicians for a lot of reasons. We want to mirror our community. That doesn't mean that every white person chooses a white physician. Every Black person chooses a Black physician. But I think it's important to have the opportunity for folks to choose a physician that is they see that could relate to them perhaps better, and make that person be available here. There's also been some data that has shown that, in fact, outcomes and care can be better in those instances. Also, there's data that shows that Black physicians, after training, end up in primary care or choose primary care, I should say, as their specialty, and choose to practice at a higher rate in underrepresented communities. So those are needs that we have. I don't know that you can completely paint that across all other health professions, but I bet there would be some linkages to that. Same thing in nursing and respiratory and lots of other areas. So it's vitally important. In some ways, it's getting upstream to the equity challenges that we have as patients and in communities, putting more folks through the education and into our system that can help with the challenge. So that's really what it's about.
Juana, when folks hear the words white coats, they sometimes think physicians. But can you talk a little bit about how your efforts to inform and recruit employees go beyond just physicians as you focus on diversity across the entire healthcare delivery system?
Sure. When I first entered the field, one of the examples. Now we call them infograms, but there was an example that I used on a PowerPoint screen of a stool with three legs. One leg was diversity, one was equity, and one was inclusion. Those are not isolated areas of service or responsibility. They're all inclusive. And so we need to have not only more physicians of color, we need more nurses of color. We need to be able to walk into the C-suites of hospitals across the country and a young healthcare executive be able to see him or herself in that role, providing that kind of leadership. We need to make sure that when we walk down the halls of our health systems that we see individuals who, as William said a few moments ago, who are representative of the community that they serve. Because further upstream, one of the things that is really important is to make sure that when we're talking about a strategy of inclusion, that we understand that there's not only the ability to be in the room as such, but to be a part of the conversation. We want to make sure that our patients or our customers and their families and support persons understand that we're going to help you, but what we want to do is to make sure that you know that having a long-term relationship with a provider is the way that you address that, making sure that lifestyle changes are appropriate, that you're being as healthy as you possibly can, because we all have a huge bill collectively. We will have a huge bill to pay for uncompensated care or for poor health decisions, all of those things which feed into the quality of healthcare in our country. And then finally, that other leg is about equity, understanding that when you look at data, William referenced it a few moments ago, there is a direct connection, or there is a direct correlation between the health, an individual's health status and the social determinants of health, things that we can't control. A health system can only control about 20% of someone's health status. We can write excellent health plans and give them all of the medications that they require and everything that they need. But I also heard William make reference a couple of years ago to a statistic that was perceived very alarming. We've heard about it internally, but I think the public heard it for the same time, for the first time, about 2.5 miles to the north of our emergency department. The life expectancy there is 82 years. 2.5 miles to the south of our emergency department, the life expectancy is 67.9 years. There's and this is all within a 5-mile radius.
It's a big jump.
There are challenges with that. You know, we need to find a way to bring fresh food to food to communities. We need to make sure that individuals have opportunities for transportation. They have opportunities for employment, all of the things that hospital system or health system can't control. So we got to have those relationships if we want to truly create an environment that is equitable for all.
And using that example in this next question to you, William, so a healthcare system is oftentimes one of the, if not the largest employer in a community, super vital to a community. What opportunities do you see ahead for AnMed or other healthcare systems to lead with initiatives when it talk about issues like this, the great divide that Juana just mentioned?
Well, we definitely sit in a good place. Healthcare is local. Going back to my early training, you always heard that healthcare is local, and that's so true. I would also say healthcare is the responsibility of everybody in the community, and everyone in the community has a desire to live at their highest and best, and most joy in life. Our opportunity is to work with everyone, to connect, to get folks involved. This organization has a rich history of doing that in so many ways, so many ways. We're adding on to that. We're fortunate. We have a lot of great things going on in our community. things like community gardens and classes and healthful living types of engagements and things like that, and working with multiple different groups. But there's still a lot to be done. We are one of the largest employers in our community, and that positions us well in a multitude of ways. And one of those is we are a combination of over 3,500 individuals that live all across our community, and they're invested here. They choose to live here, and they want things to be better. And while they have a role in our organization, or a career in our organization, the bigger purpose is having a full and joyful life here. And they want to do that individually, and when they can help connect their hospital, their health system, their friends to those goals, I think it gives us great strength. We are at the tip of the spear, so to speak, sometimes, because we see the challenges that happen in our emergency department when folks have an acute episode that, sadly, if they had been eating better, exercising, things like that, maybe that could have been avoided. But now we are the fix-it shop, so to speak, for the acute situation. We're very interested in helping and working with our community to alleviate that. Juana mentioned those life expectancies. That's not okay. That's not okay. But I will say, it's also not something that AnMed can fix. Mm-hmm. But AnMed and all of our connections in the community, we can have an impact on it. And we have a desire to do that collectively. And that's powerful.
Right. Well, speaking of the important role of a health system beyond the walls of the hospital, Juana, AnMed recently partnered with Anderson Area Remembrance and Reconciliation Initiative with respect to the unveiling of a special sculpture. Can you talk a little bit about this effort?
Sure. There's a long legacy, if you will, of the history of racial terror in this country. Obviously, we cannot do anything about our history. We certainly don't want to do anything about our history, because it is exactly what it is. It's the story of our country. But I think that the challenges of the Reconstruction era introduced racial terror to the country in a very different way, in a very uncomfortable time in our nation's economic history. And so if you, certainly your viewers are familiar with the era of Reconstruction, and we found that here during that time period, about the late 1890s to the early 20th century, there were individuals, about 4,000 individuals, who were lynched across the country, across primarily the South. And 5 of those victims were in Anderson County. We connected during COVID, much like this. We were in a virtual space, and 6 of us had an opportunity to connect with the Equal Justice Initiative out of Mobile, Alabama. And the work of Brian Stevenson has been about making sure that individuals, communities all across the country where these atrocities took place, we did 2 things. We remembered so that we could reconcile. In other words, we acknowledge what has been a part of our history, but what are some of the things that we can do to move beyond that? One of those issues is to use the arts. One of those opportunities is to use conversations. One of those opportunities would be to engage young people who may or may not know or be as familiar with the history of Reconstruction, to engage them in opportunities to discuss that time in our history and consider things that would move us forward. So what's the connection between this work and healthcare? We find that there are generational legacies. When you look at those families who live in the communities where there's a shorter life expectancy, perhaps health is not necessarily at the top of one of their family's considerations. When you look at economic relationships, it's with a check cashing company as opposed to a bank. When you look at fresh fruit and accessible food, you may see that that's what you get at the quick shop versus a grocery store or a Walmart market. So I think that the challenge is to recognize that the culture where we are today, acknowledging the history of where we've come from, and understanding that it's our opportunity, collectively our opportunity, to introduce other options, to try to find ways to help people secure financial independence, and to understand the value of living a healthy lifestyle and making wise choices, not just because it helps the hospital if they do so, but it certainly will help their families for generations to come. So it's about having that long-term conversation. This has been, or it is rather, a wonderful experience. We've been able to secure the corporate support of AnMed, the corporate support of Anderson University, the support of the city council and of county council in endorsing and supporting this work publicly. So we're excited about that. It has gone, we are its second residency. It went first to a growing and thriving church out in the county. It came to us and is going on to another site. Each site is to host it, create conversations and activities around the artwork, and to tell the story, not to anger or to enrage, but to inform and to move forward.
William, I saw you are, of course, were at the event as well, but I saw it shared across multiple platforms, social media platforms, from people who went. Juana, whether it was Bobby or somebody else, I saw a lot of people sharing, very proud of the effort that you guys supported.
Definitely so. And Juana has led some programming around that and further conversations. We had one recently with some leaders from regional law enforcement. And I would tell you why the sculpture and the art and the stories are irreplaceable, really, as far as the impact. The conversations around specific things going on today, I think are arguably even more important. So it gives us an avenue to have those conversations, and I'm grateful for that.
I'm grateful that you guys stand up and lead like that. Final question for you, just continuing on the theme of good work. There is a lot of healthcare progress underway in your healthcare system, William. I read about a new maternity center. Could you just share a little bit about what's going on at AnMed?
Certainly, I would love to. One of the reasons I wanted to come here was we're a growing community, we're a growing health system, and we have opportunities. It's much more fun to be in a place that is growing and wants to grow than it is in a place that every day is about squeezing out something. And while we're very efficiency focused, we are very focused on growing. And a few things. We're growing access across our system. I mentioned 60 plus sites. That seems to be growing every a week or two that we're adding access to give our community more ways to get their healthcare needs met. We're building our medical group. We have over 150 physicians in our medical group today. Majority primary care, but specialties as well. That's something that was started a long time ago, and we're building on it, and I'm grateful. We have a wonderful team of physicians. We're innovating in a multitude of ways, but one example I'm particularly excited about right now is in about a month, we'll open our first young adult medicine clinic that will be on Clemson Boulevard, and it's specifically focused for those folks that are young adults that are still seeing their pediatrician. No offense, we have great pediatricians, but I can remember back to that time that it's kind of uncomfortable that, okay, you're a little old, you don't want to be sitting in the waiting room with 12-year-olds and 10-year-olds, but on the other hand, you don't want to go to see the internist that your mom and dad do either. This is going to be focused specifically on that segment of the population and really engaging with them in some new ways that we think meet them where they are. We are improving. You mentioned our maternity, women's birthing center is brand new at the medical center. We're very excited about that. It's going very well, and it's just beautiful, modern space. Some other service lines, orthopedics. This was started before I came, but we continue to build on having a subspecialty based orthopedics practice, which has not really been available in our system in the past. So we're very excited about that and that growth. Cardiology, tremendous growth in that area, minimally invasive techniques, electrophysiology. I'm very proud. Juana was alluding to one of our newest physicians who happens to be a Black female, but she's one of our newest interventional cardiologists. We actually brought two females, and female cardiologists are hard to find, and we're glad to have two of them join our team. Surgery, minimally invasive services and growth across all aspects is just exploding. And then sports medicine, very proud. We've had a longstanding fellowship program to train physicians in non-surgical sports medicine, but we just finished establishing a relationship with Anderson University that we are their healthcare provider. A big piece of that will be part of and partner with the new football program, but it's all of the athletics there, and very excited about that. And finally, I would say we're aggressively working upstream with all of our school partners. They're very important. Certainly the colleges, technical schools, Tri-County Tech, Anderson University, Clemson, Southern Wesleyan, North Greenville Tech, all of them, we get folks and we need them. But we're also working with high schools and even earlier than that to really connect upstream to help folks get interested, find where there's a place. I really believe there's a place for everyone in healthcare, whether you think you can go to school for 8-10 years to be a neurosurgeon, or just 2 years is a commitment for you, and you could still be a nurse. I met with some young folks from the high school last week that we had here for the day, and they're rising seniors. And I said, did you realize you could be 36 months from today, you could be working here as a registered nurse, as an example, and earning a considerable salary and having your employer support you to go on and get your bachelor's degree just 36 months from now. That's exciting, but we're focusing on building. We have exceptional strategy. I believe that we have built and I continue to grow exceptional management, really focused on bringing value. We are focused on building our culture. But if you add together exceptional strategy, exceptional management, and exceptional culture, that's how you deliver exceptional performance. And that's what we're really about. And that's why we're bullish on our mantra of better starts here and better starts with us.
Well said.
You've got a lot of blessings underway, but I know that your system's also been a blessing. So some of it might be that as well. William Kenley, CEO of AnMed, Juana Slade, rock star, and also Chief Diversity Officer and Director of Language Services. Thank you so much for joining us today, talking about the good work that you have underway, and just press on. We are just, on behalf of Matthew and everyone taking the pulse, thank you.
Thank you both. And it's an honor to be here and represent our team. And I know Juana feels the same.
Ditto.
For those of you who joined us today for Taking the Pulse, we hope you enjoyed this conversation about everything that's going on and the good work in Anderson, South Carolina via the AnMed healthcare system. We look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.